Welcome to another edition of Pew and the Pulpit from the Anglican Church of the Holy Spirit, Bronze. Today I have with me Dr. Somechukwu Onoha, and he will be here talking to us about an important aspect of health which we have been struggling, more especially in Nigeria, and also around the world. He will be speaking with us today on stroke. He's an expert on that area, a doctor, so he will be discussing and let us know what is stroke. He's going to tell us what is stroke. He's going to explain it to us so that in a layman's term, we will know what it is and also how to prevent it when we start experiencing some symptoms like that. My name is Reverend Clifford Erondo. I am the curate of this Anglican Church of the Holy Spirit. So, Dr. Somechukwu Onoha, please, you're welcome to this edition of Pew and Pulpit.
Thank you very much.
So, please, can you, this issue of stroke has troubled Nigerians, and all over the world, people are dying. And it's good that people don't know what is stroke. And that's why somebody will, all of a sudden, somebody say, hey, he has stroke already, the person fall, and that's it. So can you tell us what actually is stroke?
Thank you very much, Reverend Clifford. So stroke is one of the medical conditions that is prevalent the world over. It's also called a cerebrovascular accident, CVA, in the layman's terms. So a stroke primarily is when there is an accident that affects brain function. So this accident could be in a blood vessel carrying blood to the brain or a blood vessel inside the brain. So in a nutshell, there is an effect or a disturbance of brain function due to impaired circulation to the brain. In a nutshell, that's what is a stroke.
Okay, thank you so much, Dr. Somechukwu. And now that you have given us a working definition of what stroke is all about, can you tell us what should somebody be looking out for when somebody says having symptoms of stroke and you do not know? So that everybody will be carried along, what can we be looking out for when somebody says, so that somebody will know anytime you're having these symptoms, you know that you're having a stroke, it's about to strike?
Thank you very much. So, like I said initially, so for a stroke happening, what happens is that there is a disturbance. There is either an obstruction, which most times we say there's a stenosis, or which could be a blockage, or there is rupture, or the blood vessel itself bursts open. Either of these two could result in a stroke. And like I said, it could be a blood vessel that is on its way to the brain, that's in the neck, or a blood vessel inside the brain. What do we look out for? What we look out for primarily here in America, there is an acronym we call FAST, F-A-S-T. FAST, these are the main symptoms you look out for that will help you point to the direction that somebody could be having a stroke or a cerebrovascular accident. F itself means facial droop. So, or an abnormality in the facial expression. So this could be weakness of a side of the face, drooping of the eyelid, or impaired sensation in the facial region. Second one is arm, A, arm abnormality. So this usually is, there's a weakness of an arm. So normally you look at the person, they bring out their arm, the two arms, and one of them is sliding down. Second one is a speech difficulty or a change in the person's speech. So you see somebody's speech is slurred, or they're speaking very slow, or they're speaking in a way that you can't make out what they are speaking, or somebody who ordinarily does not stutter and he starts stuttering. So that's the S. The last one is T, which is time. Very efficient, very effective, and also very efficient in terms of our management of stroke. If you notice any of these, we normally say here in America that you should call 911, and that is what will help the emergency services to come to help you out. Other things you might notice that will point towards the direction of a stroke is an abnormality in balance or gait, poor coordination. Somebody starts working abnormally, or also somebody has an unexplained headache, or other speech deficits, which may not mean slurring or stuttering, but you just notice that the person's speech is off. Any of these would be the things that will point towards a stroke.
All right, doctor, in the region we came from, more especially Nigeria, it's covered that when people start having this kind of signs, they will say, oh, my enemy have come. And discover that people now blame the devil for everything. Well, these are the little things we can tackle, and you can go to the hospital, and it will be solved, and the issue will be taken proper care of. But our people tend to think of, oh, there's somebody has sent an evil arrow to me. Somebody doesn't like me, or somebody want to finish and destroy my family. So can you tell us what can we do to prevent stroke?
Thank you very much. Before I delve into what we can do, let me address the first thing you mentioned, which is some of the misconceptions of stroke, that it is something sent by the devil, it's my enemies against me. Stroke all over the world is something that is prevalent as we age. Notoriously in the black population, it's commoner in the black population. Here in America, every year we have 800,000 new or recurrent strokes each year. Every 4 seconds, a person has stroke-like symptoms. Every 4 seconds. And every 4 minutes, somebody dies as a result of stroke. Stroke costs America $74 billion to treat per year for stroke. And also, about 150,000 people die each year as a result of stroke. So, ladies and gentlemen, it is something very common as we grow older. As you grow to 35 and 40 years and above, it is something common that could happen. And coming to your question then, what can we do? So, it goes back to what we call the stroke scorecard. So, there is normally a set of items we look at to see what happens. What's your risk level? Do you have the propensity to develop stroke soon or later? So these things go to what we call the stroke risk factors. So risk factors are things that are modifiable, which are the things you can change, and some that are not modifiable. Things that are not modifiable are things like age. As we grow older, as I mentioned, anything from 35, 40 years and above, yes, increased risk of stroke. Family history of stroke, you cannot modify it. That means a family member already had a stroke. Personal history of stroke. So if you had a stroke before, there's increased risk you could have another one. Then the modifiable risk factors are things like smoking, alcohol, medical conditions like high blood pressure, which is one of the most common factors that precipitate to stroke. Diabetes, high cholesterol level. These put together, lack of exercise or unhealthy diet. These are the factors that increase your risk of stroke. Attempts to avoid or minimize or reduce your indulgence in any of these factors, controlling medical conditions that you have, these are the things that will help you keep away from stroke or reduce the risk of you having a stroke. In this, what we call the stroke scorecard, we put it's a leaflet which we normally have in our clinics here. It has a set of factors from all these medical conditions I mentioned, including abnormal heart rhythm. If you have any of these, we normally put them together, check how many factors you have, and we grade it from low risk, moderate risk, and high risk. And we can tell you where you're falling in this scorecard, and we tell you your risk of stroke.
Okay, thank you, Dr. Onoha. I know that more especially our people don't have medical facilities back in Nigeria, and even the ones we have they don't have the treatment, the machines, like as we have it here. And people tend to, once they're having these symptoms, they go to church. We're not disregarding about things of spirituality. Spirituality is very, very important, but because people believe they have faith. But everybody may not have equal faith. So some people will tell you the enemy has sent an arrow. What I'm believing he is saying is that as Nigerians, as people from all over the world, if you are having these symptoms, as he just pointed out, that we should go and seek for medical attention, because these things are helpful so that we can dictate it on time. And so, doctor, is there any treatment that's available to help treat this issue or these symptoms of stroke when we start having it? Is there any treatment available?
Yes, thank you very much. So, like in our practice, before we go to treatment, we have to diagnose what the problem is. So I will start by telling you the types of stroke. There are two main types of stroke. One is the ischemic stroke, and the other one is the hemorrhagic stroke. Remember when I said what is a stroke? I said there's an obstruction, an accident, a blockage in the circulation going to the brain or inside the brain. So when there's an obstruction, a blockage, we call it an ischemic stroke. About 85% of all strokes that occur are as a result of this obstruction. Then you have the remaining 15%. This is as a result of a burst or rupturing of the blood vessel. So these are the two main types of stroke. Unfortunately, the hemorrhagic stroke, which is when the blood vessels burst open, causes up to 30% of the mortality, that is death, as a result of stroke. So that's for the types of stroke that we have. Then, what treatments are available? So when you have any of these symptoms, like I mentioned here with the acronym we call FAST, you call 911. We have a time of 90 seconds from when you call for the dispatcher to dispatch the ambulance to come to the place. And we have 8 minutes to actually bring you to our hospital or health facility. And when you come to the health facility, normally the doctor will take the history. Normally the way we do it, ladies and gentlemen, do not be worried when the doctor starts asking you, did your grandfather have any symptoms? Your mother had these symptoms? What we're trying to do, remember, as I told you, a family history of stroke is a risk factor for stroke. So we want to build a profile to know where do you fall in this stroke scorecard. So with this, we can know if do you smoke, do you take alcohol, do you exercise, what medical conditions do you have, what medication do you take. So these things helps us to know more about your background, know where you're falling in this stroke, and know then what are the symptoms, and most importantly, when did you start having these symptoms. What we know from science is that if you're able to come to the hospital between 3 to 4.5 hours from when you started having the symptoms, we're able to give you some advanced treatments, give you what we call the clot buster, called the TPA, tissue plasminogen activator, which is just an injection we give you, and that will go in and clear up the blood clot somewhere in your brain. But we do lots of tests, apart from asking you all the questions and the doctor examining you with all the instruments and doing all sorts of tests, including imaging, which is like kind of X-ray, echocardiogram, a CT scan of the brain, which is a test that we put you into the device, a machine, to make sure that to actually determine which stroke do you have. Is it the one that the blood vessels burst open, which is hemorrhagic, or is it the one that is just a clot? Because these things help to inform the type of treatment you're going to get. So these investigations we do, the blood tests we do also, to be sure that you're not having other medical conditions. Remember, kidney disease, liver disease, cholesterol level, your A1C, which I mentioned the other time, which is what we use to diagnose diabetes. So this helps us to know what other medical conditions you have. One, what could be the etiologic cause of your stroke, because this helps us in management. So this is how we now arrive at the diagnosis of a stroke. Of course, when we do the CT scan of the brain, it will tell us if you're bleeding or if it's just an obstruction. And sometimes we don't get it by this, because most times people don't come early, especially in areas where there are challenges with healthcare, that they may not be able to come to our center between the 3 to 4.5 hours. Then we do other things, like if it's where an MRI is available, we do an MRI. That will help us also know more what stage the person is. So after making the diagnosis, what treatments do we have? There are all sorts of treatments. Like I said, in stroke, time is brain. So the earlier you come, the easier for you, the prognosis is better, the recovery is better. So if somebody comes within 3 hours to 4.5 hours from the onset of symptoms, and we do the test and we see that it's not a bleed stroke, that is just a blockage, and they meet other criteria.
Hi, friends, I welcome you. My name is the Venerable David Nwanepe. I am the rector of the Anglican Church of the Holy Spirit here in the Bronx. If you find yourself anywhere around the Bronx, New York City, feel free to worship with us. We worship every Sunday, and we have our Bible studies every Wednesday. For Sunday services, we start our services at 11 a.m. and through 1 a.m. And the address, if you want to locate us, you will locate us at 3840 Seaton Avenue here in the Bronx. The zip code is 10466. 10466. To reach us by phone, you will reach us at 929-944-3424. 929-944-3424. For email us at anglicanchurchoftheholyspirit@yahoo.com or info@anglicanchurchoftheholyspirit@.org. Or you can as well visit our website at www.anglicanchurchoftheholyspirit.org. And feel free, call us, come worship with us. We worship every Sunday, and on Wednesdays is our Bible study. It starts at 7 p.m. Zoom. You'll find our Zoom link here and also on our website. Or you can WhatsApp us. We're also on WhatsApp. Our WhatsApp number is 929-944-3424. 3424. That's our WhatsApp number. So reach us, contact us, feel free. For weddings, baptism, our church, we are open. So long as you walk in and accept Jesus Christ, you'll be baptized and you'll become a member of the faith of Christ. And if you are a member and you are married, feel free. We also offer wedding services. And there are so many packages, revival programs. So you are highly welcome. Thank you.
So, as I mentioned, the treatment will be dependent on the cause of the stroke. Like I said, it could be ischemic stroke, which is a blood clot or blockage of the vessel, and it could also hemorrhage, which is the vessel bursts open and there's a bleed. So in terms of treatment, if there's a bleed stroke, most times in the hospital what we do is we maintain the pressure at a slightly lower level, because if you keep the pressure high, the person is going to bleed more. And in those patients, we don't give them any blood thinners. So most people, to reduce the risk of stroke, are giving aspirin. But you see that if you came to the hospital with a bleed stroke, we don't give you aspirin. We don't give you any blood thinners, because that will make you bleed more. And these patients also, we monitor their blood pressure and maintain at a lower level. Then if it was an ischemic stroke, that is a stroke due to blockage or reduced size of the blood vessel in the brain, these people are the people we give the blood thinners. We give them the antiplatelets, which is like aspirin, which is the commonest antiplatelet which most people will be on. And then we control the other risk factors. We give them medication for the cholesterol. And you see that if you ever had a stroke, you're giving medication to reduce your cholesterol. Most people will say, well, my cholesterol is normal, doc, why are you giving me cholesterol medication? The reason is, at that point, what we're doing is secondary prevention, because you already had the stroke, so we don't want you to have another one. So the only way to protect you is to give you medication to bring down the cholesterol level. Then we also look at other systems. If you have any kidney disease, we address that. If you have any problem with your liver, and like I mentioned, if there's any problem with your blood sugar, we also give you medication to control the blood sugar. All these tie into the treatment. One, to treat the stroke which has happened. Two, secondary prevention, to prevent you from having another stroke, because once you have one stroke, the risk of another stroke is higher, especially in the first few months or within the first 1 year of that stroke. So with this would be the medical treatments. Then in terms of the lifestyle changes, we tell people about exercising, that you need to exercise a few days a week. Usually we tell people to exercise 30 minutes a day, moderate intensity exercise 3 days a week, which is about 150 minutes of exercise in a day. Then the other things will be what you eat. So low sugar, low fat, exercise, and then also vegetables. Reduce caloric intake, so do not take things that contain high sugar. These would be the things we focus on in terms of the secondary prevention and also changing lifestyle. If you're overweight, which normally we say if your body mass index, which is the ratio of your weight to your height, is more than 25, we try to give you exercise tips on what you can do to reduce your weight. This comes up in the all about the treatment. Now, other management and other effects of stroke. Definitely after a stroke, what happens is that most people have some form of deficiency or weakness or disability. That is, they are not able to perform one life activity which they were doing before. It could be driving, their reflexes are not that sharp, so they can't drive, or cooking, or many other things, or even their balance. So what we now do is to counsel both the patient and the caregiver and the family on how to adapt to this new situation, because it's a whole change of your life that you are not able to do the things you were doing before, and to most people it will be very embarrassing. So teaching somebody how to adjust. Some of the things we do, especially where the resources are, will be psychological treatments, getting the psychologist to speak to the person, do self-esteem work, making you understand that there has to be some adjustment in your lifestyle. It is not the end of the world that you're not able to do the things you're doing before. And also there is hope, because with recovery, you might be able to do them with time. So that self-esteem work is part of it. Cognitive restructuring, so for you to understand that all is not lost. Then therapy. So everyone after a stroke is referred to physical therapy and occupational therapy. Some people to speech therapy because they have either difficulty with swallowing, or difficulty with their words, or difficulty with their thinking. So these therapies usually we say 2 to 3 times a week as one could attend, but usually the physical therapy will address issues with your balance, address issues with your back pain or any pain in your lower extremities or spinal pain. Occupational therapy will dwell on your activities of daily living, your fine motor activity, using your fingers to do things, especially to write, to cook, to hold, to wash, and also other things like preventing falls, planning activities in your home. And most people will also send the occupational therapists to do a home assessment, especially people who fall as a result of the stroke or after the stroke, or people who have a history of falls. Things like activity revision and home management and what we call durable medical equipments. Things like grab bars in your home, or shower chair, shower stool, or handrail, stair lift if you have a stair at home. So these are the simple things to make it comfortable for you to live in your home. Then, like I mentioned, durable medical equipment. So these are devices we use to maintain stability, prevent falls, and be able to do the things we do. Things like wheelchair, walker, cane, various forms of cane. You have a straight point cane, we have the quad cane, 3-point cane, 4-point prong cane. So these will be the things that will advise you on how to use them. The therapists that come to work with you at home will train you on how to use them efficiently so that you can live well in your home, prevent fall. Then finally, we get people to talk to you, especially your primary care doctor, on your medication. All these put together reduce the risk of a subsequent stroke and allow us to live comfortably. Thank you very much, everyone, for listening to us. That brings the end of our stroke discussion.